Welcome everyone. My name is Leah Hanson. I'm a Senior Director at HealthPartners in Minneapolis, Minnesota, and I co-lead our Dissemination and Career Development Core with Heather Whitson. Heather, do you want to introduce yourself?
Sure. Hi, I'm Heather Whitson. I'm a geriatrician and clinical investigator at Duke University. I'm the director of the Duke Center for the Study of Aging and Human Development, or the Aging Center for short, and also the co-director of the new Duke UNC Alzheimer's Disease Research Center.
So we're here today to talk to you about the Aging Initiative's MCC Scholars Program. The purpose of the program is to create this cohort of emerging leaders with a commitment to pursue research in multiple chronic conditions, so older adults with multiple chronic conditions. Our Aging Initiative selects up to 10 scholars every year, and a part of the activities is to attend an in-person workshop if that's possible. We always have contingencies for COVID-19 as we need to these days. But this meeting or workshop is mandatory to attend April 27th to the 29th. And luckily we have that in conjunction with the annual Pepper Center meeting. So there's a lot of great learning opportunities there. Over the 1 year of participating in the MCC Scholars Program, our participants, our scholars will attend 6 webinars, and there's 4 pillars of our curriculum that we would like to describe to you. The first is the significance of multiple chronic conditions and its importance in consideration for research. The second is resources and tools for researchers in the area of multiple chronic conditions. Third is engaging patients and caregivers meaningfully in the research. And fourth is professional and leadership development. And so again, the MCC Scholars Program, we're really trying to build an exciting community of researchers with this commitment to mentor others and provide connections for more research in the sustaining multiple chronic conditions and focusing on that research. We talk about our curriculum in terms of the stool, and we're happy this year we have a diagram of the stool so you can see really the 3 legs, the significance, the resources and tools, and engaging in a meaningful way patients and families. And then sort of the seat of the stool is our basics of career development and how to be a researcher and how to get your grant funded and make networking connections. So multiple chronic conditions is really the most common condition experienced by older adults. Historically, research is focused on diagnosis specific, excluding people that would have multiple chronic conditions. And really, it's important to look at the person as a whole when we know that 77% of people over the age of 65 have 2 or more, and often very much more numbers of chronic medical conditions. And those people are often excluded, and we need to understand what are the best treatment for these people, for these older adults. Older adults with multiple chronic conditions are the heaviest users of healthcare services. For example, if you look at the 12% of Medicare beneficiaries that have 6 or more chronic conditions, they account for 43% of total Medicare spending and 50% of Medicare spending on hospitalizations, and almost 70% of post-acute Medicare costs. So the people with multiple chronic conditions are really driving the high cost of healthcare, and we need to understand the best ways to take care of these people. Next slide. I'll pass it to Heather.
All right, so we wanted to sort of start here with acknowledging that a lot of the benefits, I think, of participation in the program are sort of the intangible benefits. So being an MCC scholar doesn't protect your effort or protect or provide you project support per se, but it does in years when COVID doesn't prevent it. There is a travel award that it covers your travel to an in-person event. We do plan this year in 2022 to hold that in-person event. And I think one of the intangible benefits has definitely been, even in these COVID years, the sort of opportunity to, in a small group of like-minded people, sort of share experiences, successes and challenges related to studying multiple chronic conditions, which is by its very nature and definition, complex, heterogeneous, sometimes hard to figure out exactly where the home for this research is in terms of study sections and journal clubs. So I think having this sort of senior mentorship network as well as peer mentorship network is one of the real benefits of participation. It also provides the opportunity for grant review and specific aims review. And interaction with NIA representatives through the Pepper Center meeting and the workshops, as well as through the webinar series. And sort of exposures to these two kind of what I would call sort of national strongholds. One is the Healthcare Systems Research Network, and the other is the Pepper Center Network that contain not only mentor resources and potential collaborators, but also data, access to data and other resources. Next slide. So who should apply? So it is a requirement that you have an MD, PhD, or equivalent degree. By that, we really mean a doctorate in any sort of relevant field. So this could be DO, OD, Doctor of Audiology, Doctor of Physical Therapy, and the list goes on. So we're very inclusive in terms of discipline or background. We do look for an evidence of commitment to research in a field that is relevant to MCCs. So I want to stress that word, relevant to MCCs and or aging. This doesn't mean that you have to have already published publications that use words like multiple chronic conditions or multimorbidity, but there needs to be evidence that you have done research in a field that is easily adjacent to or makes sense for you to be seeing yourself as a future person who studies not just a single condition, but multiple conditions or the aging process. So preference is given to applicants who are a little bit earlier in their stage of career. Ideally, we look for applicants that have either not yet received an R01 or tenure or have just recently attained those milestones. We are requesting that you attend the workshop, which will be held April 27th through 29th, as well as 6 webinars during the scholarship year. In addition, we say, once an MCC scholar, always an MCC scholar. So you're welcome to continue to attend the scholar-only webinars in future years as well. As far as that in-person meeting, of course, we will keep an eye on COVID, and the expectation that you attend in person is subject to changing guidelines there. But we are anticipating that will be an in-person meeting. We also encourage applications from trainees or early stage investigators who come from groups that are typically underrepresented in research careers. This could include women, racial or ethnic minorities, people with disabilities, people with rural zip codes, and we'd encourage you to look to the NIH definitions for underrepresented groups. Again, keeping in mind that a main thing that is offered by this opportunity is the opportunity to network and collaborate. So evidence of your desire to collaborate and to be a collaborative researcher is helpful in your application. Next slide. So how to apply? There is an online application. There's a link to it there. You will be asked, we have purposefully tried to keep the application not very onerous. You don't describe a project because again, there's no project funding associated with this opportunity. What you will be asked to provide is some institutional and demographic information, your biosketch, and then short responses that are 400 words or less. And you see the prompts there. We ask about your interests and your aspirations related to multiple chronic conditions research, prior accomplishments or evidence of your potential to lead collaborative research. So again, if you can point to prior evidence of successful interdisciplinary collaboration or collaboration across institutions. How your research might have an impact on individuals who are living with MCCs, and then your goals for participating in the program. Next slide. So here I talk a bit about the review process and things to consider when you're crafting your short answers to each of those prompts. So the selection of applicants and something that I sort of want to say right up front is that in all the past years, we've been very fortunate in some ways to receive way more qualified applicants than we have slots to be able to offer. And so the selection process is really difficult, and some of the ways that you can sort of strengthen your application are to demonstrate, point to examples of evidence of commitment to and productivity in research in the past. That we do take this into account your stage of career. But for your stage of career, if you can sort of point to commitment and productivity that is particularly in an area relevant to multiple chronic conditions. The next thing that we really look for is that in each of our small cadres that we have sort of a balance, and that is a balance in terms of different disciplines represented, different perspectives and backgrounds, different institutions and geographic areas of the country. So something that I want to make clear here is that if in past years you may have applied and were not accepted, at the end of the day, as I've said, we receive so many more applications from qualified people than we can include. Much of the decision at the end comes to sort of balancing the cadre. So there is a bit of luck in that last step. And I want to make, and I say that to tell you, if you have applied before and were not accepted, do not take that as an indication that your application was not acceptable or that you were not viewed favorably in the review process. In fact, your review may have been reviewed quite favorably, and many MCC scholars have applied one time or more than one time in years past. We do keep track of that if you're a repeat applier, and if anything, this helps you. So I definitely wouldn't want people to think I should not apply again if I was not successful in a past year. Each candidate is assigned 4 different reviewers. 2 of those are scientific reviewers, and 2 of them are patient caregiver advisor reviewers. And you'll hear in a moment from our patient caregiver advisory group. Our patient caregiver advisors are one of the huge resources that our scholars gain access to. This network of patients and caregivers who participate in research at all steps and stages. So it's important for you to realize, though, that your review is being, or your application is being reviewed by senior scientists as well as by patient caregiver advisors. And one of the things that we encourage the patient caregiver advisors to really think about is, does it come across that you're aiming to make a difference in a way that is important, that matters to patients and caregivers with regard to MCC. So I think the more that you can articulate that, it's important to try to articulate your scientific acumen and training and productivity, but also to really articulate why what you're doing matters to patients and caregivers that are affected by multiple chronic condition. The reviewers score the sections, and you can see the 5 sections that each receive a score from all 4 of your reviewers, both types. Next slide. With that, I think I am going to turn it over to our patient caregiver advisors who have joined us today. Again, we are so fortunate to have this group that get to know and work with our scholars really well. And both of the women that you see pictured here have in fact worked with our scholars extensively and understand the program well. So I'm going to let them introduce themselves and take it over. But Janice Tufte, you want to go first, and then we'll pass it off to Maria.
Certainly. I'm Janice Tufte. I'm from Seattle, Washington, and I have been involved with research and evidence. And the research group that I was first involved with is where the chronic care model came out of, Ed Wagner. So I'm very well versed in this area with experience and, with knowing people, I guess. Thank you. I'm happy to be here today.
Hi, I'm Maria Pellerano from New Brunswick, New Jersey, and I am on the advisory group as a caregiver advisor. I am also a patient, but I've been a caregiver for family members since I was in my mid-20s, so I'll leave it there. So Janice and I would really like to thank Dr. Hanson and Dr. Whitson for having us speak today about the Advisory Council. And I'm going to call it the Advisory Council because I don't like the acronym. It sounds like an insurance, a type of insurance. Anyway, we have 10 patient caregiver advisors who come from diverse backgrounds, experiences, and conditions. So we have people who have and are clinicians, have been pastors, our administrators, scientists, educators, researchers. We come from the entire United States. We go from the East Coast across to the West Coast, north and south, and then over to Hawaii as well. We have one member from Hawaii. And we exist to provide guidance on research for older adults with multiple chronic conditions. And why this is important is because older adults who have multiple chronic conditions often receive care that's fragmented, burdensome, costly, harmful, and you heard they're major users of Medicare money, and often does not reflect the care they get. It doesn't reflect what the patient or the family want. And the other way we sort of cover the gamut, the way Dr. Whitson was describing how the scholars cover the gamut, is we come from rural, urban, and suburban communities. So we have a lot of different experiences with different challenges related to living in different areas of the, related to the location of healthcare systems. So I'm going to turn it over to Janice, who's going to speak about the next slide.
Thank you. Yeah, sorry. Thank you for having me here today. So I had older parents. So my father was 50, my mother was 40 when I was born. So I dealt with a lot of issues much younger than my friends who are now dealing with some of the challenges of, I call it the sandwich caregiver. But I was actually a child caregiver. My father had a brain tumor. So and passed away when I was 9. But so anyway, and I've been interested in this for a long time as far as aging well, aging better longer. So our advisory group, I'll say too, will be reviewing your applications to assess the potential for impact in the lives of patients and families. So this is what you're looking at here is how we grade or rate your applications. So and I know we discussed this in the pre-call because I remember having a couple applications that were really data focused, and you can have it be totally data focused, but whenever possible, please mention how it will impact patients and families and caregivers, if it's gaps or, if it's closing a gap or it's refining something that exists. It's very important. And we'll provide comments and a score ranging from 1 to 9 based on the following criterion. To what extent does the applicant indicate the potential to positively impact the quality of life for people living with multiple chronic conditions? So, you'd hope it would positively impact, but there could be, some of the studies might show negative impacts. And so then it's a positive impact because we would know as patients, families, and caregivers that perhaps something out there isn't the best intervention. And there's, there's opportunities for better interventions. So as you can see, we rate 1 is the highest and 9 needs some work. And I just want to add that people did apply last year. It is so hard to rate individuals, and you really hope to see them get into the scholar program and you wonder why, and we have to wait till it comes out to see, and then you see that perhaps there was 2 or 3 around the same area, and it might be because an individual was where they were located, right? So it's competitive, but please apply again. So next slide, please. And this is really based on values. So, it's important to engage patients and families in all aspects of research. And a number of us who are on this advisory are also patient-centered outcome research ambassadors. So we're very familiar with this concept and understand and evidence and research and, quality improvement in all aspects of research, that it's important to have patients and caregivers there. And I'm going to pass it back to Maria if she'd like to share a little bit more about this slide or add a few more comments. Thank you.
Yeah, so I just wanted to also add about the advisory group is that we do have a lot of experience. So if you go to the website, they have a little very short bio about all of us, but if you click on our names, you can get a longer detailed list, and you can see we actually cover almost every condition you can think of for older adults with multiple chronic conditions. And so, but this is the different ways in which we interconnect with the Aging Initiative. So it's through, we'll just start at the top, improving, identify opportunities to improve care and outcomes, and then facilitating research that's of high value to patients and providers, and then connecting with the researchers, which has been very important for the council, and I would say for the whole initiative. And then where we would be training and supporting new scientists. And we're getting more deeply involved in this as time goes on. And I think I'm going to leave it there.
All right, so I think we're probably nearing the time in our session here where we welcome questions from you. If you want to type any questions that you have into the chat, but applications are due January 7th, just before midnight. And scholars will be notified by February 16th. As we noted, the workshop will be held April 27th, the 29th. We expect that those will be 3 in-person days in the Washington, D.C. area, sort of Bethesda or D.C. I think the exact venue is still being nailed down, but please, if you are planning to apply, hold those days on your calendar. Next slide. Here's a few links where you can get more information, and I think there's facts, frequently asked questions and other information. Here are some of those frequently asked questions. And I see that we have a question. This is a really good question, and one that we anticipated would come up, and I don't think that we have a firm answer yet about, is there a restriction on U.S. citizenship of the application? We are confirming that for this year. We did during COVID times allow and encourage international scholars when the program was entirely virtual. But we are, in Chris and Ivan, I don't know if you have any updates to give on that, or even a timeline for when you expect we'll have a firm answer to the question of whether people outside the US should apply this year.
Yes, so I did get an update. International researchers can apply. So yes, they should be all set.
Great. And just to clarify there, does that mean that the international researchers, that we would also be able to support travel at the international level, or will they need to supplement their travel if in fact April is an in-person meeting?
We're still confirming the exact reimbursement details, but they can apply.
Okay, great.
So yeah, we will get back hopefully by the end of the week, have a firm answer.
Okay, there's also a clarification here asking, and what about if they are not citizens? So, and this is the same for people who are inside the US, but are not citizens, and I'm assuming that also means not permanent residents or citizens. The typical, I believe NIH dollars are not allowed to be awarded directly to non-citizen, non-PR.
Yeah, so for that, again, we would just have to confirm, but we should be able to hopefully get a final answer by the end of this week.
Okay.
It looks here like we also have a question from Jennifer about is an affiliation with a Pepper Center or an HCSRN organization taken into account when selecting a cohort? And the answer to that is yes, we do try to balance so that we want to have people from both of those organizations, but we also have people from outside. So if you're not part of a Pepper Center or part of the HCSRN, you're also very encouraged. We want to encourage you to apply.
Great. And I see also questions about subspecialists applying. And so, for example, Brennan says, are you supportive of applicants who work in a specific chronic condition as a primary research interest? For example, somebody who studies aged cancer survivors and a cancer researcher, but many of them have MCCs. And so it's a focus of the studies. But at the end of the day, saying I'm a cancer researcher, and there was another colleague that said, yes, similarly, I'm a nephrologist and the morbidity that I'm always going to be focused on is kidney disease, but I'm interested in MCCs. And the answer to all that would be absolutely yes, that we have certainly had scholars whose training and focus is around a particular index condition. But what I would tell you to do is make it very clear in your application that the MCC element, the chronic condition, other comorbid conditions, or complexity and morbidity burden overall is I would say a salient interest in your work in your subspecialty field about your index condition. So I think it needs to be more than just, well, this is an index condition that frequently occurs in older people, so I'm sort of interested in aging, or this is an index condition that often involves a lot of multimorbidity. And so all the people that I enroll have multimorbidity. I think we would really want to see in your application how you're particularly hoping to address issues about multimorbidity or the complexity of the patients with that index condition as a focus of what you're trying to do in your research in that field. And part of that is because it would be important to make it clear why it would be beneficial to you to have these hopefully sustained networks and collaborators who are in the field of aging and in the field of MCC. So I hope that answers it.
Yeah, and Alyssa also asked in the same line as with the subspecialties, do you welcome biostatisticians to apply? And I think we say, yes, please apply. Annette is asking about, concerned about travel restrictions from their university, and it may be that they would be unable to travel if there was a ban in place, and asking, should I apply or not? I think we would say we definitely understand if there's institutional restrictions, so we encourage you to apply, and we're all kind of playing it by ear, but don't let that be the reason to not apply. Heather, there's a question about what is our typical balance between MDs and PhDs in our cohorts? Yeah,
it is something that we work hard to strike a balance, similar to the other factors that we try to balance, like affiliation with Pepper Center versus HCSRN versus neither. We try to have a balance in each cohort cadre. Similarly, in each cohort and cadre, we try to have a balance of MD and PhD investigators. And maybe rather than just saying MD, I should say clinician and PhD or clinician and non-clinician investigators. And Leah and I represent both of those, so we keep each other honest in that balance.
Let's see, Noam is asking about expectations. So other than webinars and the meeting, are there other events or assignments that are required other than the intangible benefits? I'd say no. Occasionally there might be homework to prepare an elevator speech for one of our webinars or to watch a recording prior to a webinar, but we try to keep the burden minimal and do our work when we get together. But I'd also say the more you put into it, the more you get out of it. And when we talk to past MCC scholars, one of the thing that's most valuable is the peer connections and the interactions and networking with others within the Aging Initiative and the Pepper Centers. And so I think what we require and what's possible is very different spectrums. So we encourage you to kind of nurture those relationships and make connections and find collaborations that aren't a part of the required curriculum.
I see a question here saying, can we apply if we don't have a research project currently on older adults with MCCs at the moment, but we did in the past and we would like to again in the future? And I would say absolutely. And I think that you'll just want to maybe address that directly in those 400-word text answers that you have, because I think if your biosketch shows sort of no current research in the area of aging or MCC, it is the sort of thing that reviewers might question or pick up on. But I think if you address it and can make a explanation for how you're confident that this is something that you want to do in the future and what you're planning to do in the future, I think that certainly fair game.
And I want to make sure we answered all of the questions about citizenship and residency and all those things. So maybe, Chris, can you put your or Ivan's email in the chat? So if there's anyone else who has questions or they want to be followed up to ask something more specific, that you can do that through the email. So I know there was a lot of very specific questions there. Any other questions from the group?
The application link has gone in the chat, as well as Ivan's contact information there.
Well, we're really happy to have so many people join us for the webinar today. If you think of any questions we didn't answer, please don't hesitate to reach out. I think we recommend looking at the website. There's a lot of information there. Alyssa, you have one more question?
Yeah, sorry, I'll just say it out loud if that's okay.
Yeah, perfect.
I didn't think I could type fast enough. Is there an emphasis placed on whether you've had a certain number of like PI funded research projects versus working on a variety of different projects with co-investigators as a co-investigator?
Yeah, it's a good question. And I would say that similar to sort of publication productivity, your funding track record is something that we look at and we're mindful of stage of your career. And so ideally, we probably are ultimately looking for people who are on a track to be PIs or driving their own research agendas and developing their own research questions. But as I say that, I'm also thinking that if you are a person who was thinking, no, I see myself as a collaborative, say, methodologist or something like that, then I think if you just articulated that and made the case that you want to be the person who can always sort of bring MCC methodology or an MCC perspective to any research team, that would not be, I would say, the most typical, but that case could be made as well. But certainly if you're just someone who, due to stage of career, you haven't yet had a lot of PI funding, that the stage of career is absolutely taken into consideration in the review. Does that answer it?
Yes, thank you. That was very helpful.
Sure. And for any of you, for those who may be sort of focused on methodology or statisticians, I would encourage you, to really think about the piece that we, in partnership with the Patient Caregiver Advisory Council, it is really important to articulate how what you're doing will translate into better life, health, outcomes that matter to people living with multiple chronic conditions. So I think that is true for anyone out there who's researching this area, but I think the more that you can really articulate that and make that message come across clearly is important. And I think it's important for all of us to challenge ourselves to do that anyway in the work that we're doing. So. All right, well, I'm not seeing any new questions. And so I think we may be able to give people 20 minutes back, and feel free to reach out to myself, to Leah, to Chris, to Ivan. We're looking forward to reading your applications and happy to help along the way.
Thanks everyone for attending today.
Thanks Janice and Maria for being here.
Thank you for having us. Thank you, and good luck to everybody.
All right, thanks all.